with L&R, and today we are going to discuss about the holistic health model. Holistic means whole, and first of all we would like to discuss about what is holistic care. Under this, the word holistic was coined in 1926, and it is root from Greek words that is holos, which means whole, entire, full. Holistic health views the physical, intellectual, socio-cultural, psychological, and spiritual aspects of a person's life as an integrated whole, related to person's own, their mind, socio-cultural means where they live, how they think, and their faith in religion. Fine. Holism, frame sound or correction, holos, entire or whole, derived from Indo-European roots, that is solo. The concept, when applying the concept of holism to states of health, elicited that health can be influenced by an individual's ability to adapt to changing environments. When person easily adapt the changing environments, age of the person, time of suffering, and expectation of death. Next is concept. This implies that individuals have potential to influence their own lives, and the holistic care should consider the whole human experience. And the three concepts are there: physical health, spiritual health, and emotional well-being. Then ancient approach 5000 years ago in India and China stressed a living healthy way of life in harmony with nature. An approach to health based on the love of life, not a fear of death. Live in the present, not bother about the death. Leads to high level of wellness for the total person throughout the total lifestyle. Facets of holism. Three things are included together: body, mind, and spirit. Personal inner resources are important as external ones. Inner resources are feeling, are thinking, and links between the body and the mind. Then individual inner resources: physical, spiritual, social, psychological. Then what is holistic nursing? Holistic nursing focuses on promoting health and wellness, assisting healing and preventing or alleviating suffering. Then a philosophy of nursing practice that takes into account total patient care, considering the physical, emotional, social, economic, and spiritual needs of patients, their response to their illnesses, and the effect of illness on patients' abilities to meet self-care needs. Uses medical knowledge plus complementary therapies, alternative and integrative methods to care for the patient as a whole. Then goal of holistic nursing. The goal of holistic nursing is the enhancement of healing the whole person from birth to death. Involves the harmonious balance of body, mind, emotions, and spirit within an ever-changing environment. The balance of the person always will be there. The conditions might be changing the environment and another kind of stressful situations. Considers the whole person including physical, mental, emotional, and spiritual aspects. Then body, mind, and spirit relationship. The individual according to Indian scriptures. The formation of body and Purusha, the soul. Spiritual is the cause of expression of pleasure and pain, guided by mind, intellect, and ego. Mental conditions affecting bodily functions. When we think positive, then positivity we can feel. When we think negative, then our energy goes down. Our emotions and strong feeling affect the body inwardly and outwardly. Unpleasant emotions such as fear, anger, worry cause headache, insomnia, indigestion, and deep thinking and concentration can cause physical fatigue. Mind motivates all physical and motor activities. Emotional conflicts are responsible to cause various illnesses. such as hysteria, gastrointestinal troubles like peptic ulcer, ulcerative colitis, and flatulence. Then historical perspectives. Based on Florence Nightingale work in 1970, nurse scholars start concerned with concept of whole person, and it is about history. Then principles of holistic care. All people have innate healing powers, means by birth everyone have willpower to heal their body. The patient is a person, not a disease. Healing takes a team approach involving the patient, doctor, and addresses all aspects of person's life using a variety of healthcare practices. Treatment involves fixing the cause of the condition, not just alleviating the symptoms. What is the condition? For example, person suffering from stress, and the thing cause the stress that will be eliminated from his life. Difference between traditional and holistic nursing. Traditional have knowledge related to nursing, limited methods of care, treats all patients, and uni-level care to patient. And in holistic, need additional knowledge, creativity, unlimited methods of care, usually treat patients with severe conditions, tri-level care of patient. Uni-level means only one aspects we can consider, and tri-level all the aspects related to body, mind, and spirit. Then found at every healthcare facility, and in holistic found at more specialized healthcare facilities. In tradition, easy to get job as traditional nurse and need special areas to provide care in holistic. Holistic health model. Healthcare considers emotional and spiritual well-being and other dimensions of an individual as important aspects of physical wellness. The holistic health model of nursing attempts to create conditions that promote optimal health. Optimal means full. Caring, healing inquiry for holistic nursing practice. Then in this model, consider patients to be the ultimate experts concerning their own health and respect patients' subjective experience as relevant in maintaining health and assisting in healing. Involvement of patients by assuming some responsibility for health maintenance. Then nurses using the holistic nursing model recognize the natural healing abilities of the body and incorporate complementary and alternative interventions such as music therapy, relaxation therapy, therapeutic touch, and guided imagery. These kind of therapies are helpful for the patient to recover by own. Nurses use holistic therapies either alone or in conjunction with conventional medicine. Music therapy in OT creates a soothing environment, and relaxation therapy during a painful procedure such as dressing can relax the patient. Core values of holistic care practice. There are 5 kind of core values we will discuss next. Core value 1, holistic philosophy. Develop and expand overall philosophy in the art and science of holistic nursing. Holistic education. Acquire and maintain current knowledge and competency in holistic nursing practice. Core value 2, holistic ethics. Hold to a professional ethic of caring and healing that seeks to preserve wholeness and dignity of self, student, colleagues, and the person who is receiving care. We have to we have to give respect to ourselves in the form of self-respect, then respect to our student, respect to our colleagues, respect to our subordinates. Then holistic nursing theories recognize that holistic nursing theories provide the framework for all aspects of holistic nursing practice and transformation leadership. Holistic nursing and related research provide care and guidance to persons through nursing interventions and holistic therapies consistent with research findings and other sound evidence. Then core value 3, holistic nurse self-care. Nurses or medical professional self-care, care themselves, then they provide care to the patient. Engage in self-care and further develop their own personal awareness of being an instrument of healing to better serve self and others. Then core value 5, holistic communication. Engage in communication to ensure that each person experiences the presence of the nurse as authentic and sincere. Then therapeutic environment. Recognize that each person's environment includes everything that surrounds the individual, both the external and the internal, physical, mental, emotional, social and spiritual, as well as patterns not yet understood. Cultural diversity. We have to respect the background, we have to respect the culture of the patient and know about the background of that particular culture. Then core value 5, holistic caring process assessment. Each client is assessed holistically, means not we do not know only about the disease of the patient, we have to know about the body, mind and spirit. We have to give the value to the patient. And patterns, problem and needs. Actual potential pattern, problems, needs and life processes related to health, wellness, disease or illness which may or may not facilitate well-being. Identified and prioritize outcomes. Each client's actual or potential patterns have appropriate outcomes specified. Then therapeutic care plan. We have to provide the holistic care to the patient. Each client engages with the holistic nurse to mutually create an appropriate plan of care that focuses on health promotion, recovery or restoration or peaceful dying, so that person is as independent as possible. Implementation. Each client's plan of care is prioritized and holistic nursing interventions are implemented accordingly. Next, evaluation. Each client's responses to holistic care are regularly and systematically evaluated, and the continuing holistic nature of the health process is recognized and honored. This is all about holistic health model. I hope you have clear with this. If you feel any kind of difficulty, kindly inform me. I'll surely help you. Thank you very much.